with Dr. Daly today. Hey,
Hello.
Dr. Daly.
How are you?
I'm good. And today we're going to be talking a little bit about what a dental implant is, because it can get confusing.
It can.
And two, the general timeline of getting one done.
Okay, sounds good.
So let's start at the basics. What is a dental implant?
So when a patient loses a tooth, a lot of times we want to replace that tooth. There's a lot of different reasons we want to replace that tooth. If it's a front tooth, there's aesthetic reasons. Obviously, we don't want to be missing a front tooth.
No.
If it's a back tooth, it's important for chewing. And when a patient is chewing and you lose teeth, it's all about load disbursement. So you want to have an implant back there to disperse the load a little bit better.
I didn't even think of that. Because
Yeah.
it's true, then you could put a lot of pressure on the other side and then cause problems.
Exactly. It causes problems on the other side if you lose a tooth on this side. So we replace teeth with a titanium screw. That titanium screw, a lot of people think it holds the tooth. It's all one piece. But actually the titanium screw is individual from the future crown that's going to be placed on it.
Right.
So that would come from the dentist. So for us, what we do is we do extractions, we do bone grafting, and we do the implant placement. And the way I describe an implant is it is titanium root. It functions as the root for a future tooth. It's completely encased in the bone, and the process by which it heals is called osseointegration. So the bone actually grows into little micro abrasions on that dental implant and stabilizes it. It's actually a really cool process because it actually integrates that titanium into your bone.
That is wild, because we had talked about this on a previous video, that with the bone grafting, it almost like tricks your brain to create its own bone.
Exactly.
That's wild.
Exactly.
To me, that really is.
Yeah.
When you come to the oral surgery group and you get a dental implant, it's like the foundation of the house. So you have to go to your dentist to get all the siding and everything like that. You just, the foundation and the really important part is done here.
Yeah, and we do it in a very special way. We do it CT guided. So we use a patient's individual CT scan that is specific to them to place the implant in a perfect spot for their dentist, so that their dentist has a slam dunk when it comes back to them.
Nice. Is there an instance where, like, ow, I lost my tooth, and then I come here, that I wouldn't necessarily need bone grafting, or do you always recommend bone grafting?
If a tooth has been missing for a while, we often recommend bone grafting because there can be a loss of bone over a certain amount of time. Anytime we extract a tooth, we like to place a bone graft because of predictability. That scaffolding makes it more predictable for us to place an implant into that site in the future. And it's that predictability and that ability to place an implant that will support a tooth for a long time that is important to us. So we often recommend, and almost always recommend, bone grafting.
It's like, again, with the house analogy, you want to make sure you have a consistent from start to finish. It's done here, we know the product. We have a standard that you are going to have from the beginning of your treatment to the end of A+ service and A+ materials with A+ surgeons. So that's the way that you should go.
There are a lot of different implant companies, and there are a lot of secondary market parts and pieces, and what we use here are the two implant companies that have been around the longest. They have been there since the beginning, and their products are the best, and that's why we use them here.
Absolutely.
And we want to ensure that our patients get the best. They're the more expensive implants, but we don't pass that cost along to the patients. We want to make sure that our patients have a successful implant every time, and so we use the best products available.
And it reflects on you, because
Yeah,
you don't want to have
absolutely.
not the best product, because then our end result isn't going to be as great.
Absolutely.
Let's go over typical timeline for a patient.
So if we have to extract that tooth, typically we would extract that tooth and place a bone graft. In the same sort of process, we want to make sure that you have a tooth in that site. We don't want you to be without a front tooth. So we work with your dentist, or we have the ability to make you a temporary tooth that
That's
you
great.
could put into place and keep in place while we're in the process of getting you something that is permanent. We would allow that bone graft to heal for 4 months. About 3 months into that process, we would do that CT scan we talked about. That CT scan gives us a 3-dimensional picture of the site where we want to place the implant. And then at 4 months, we can place that implant. 4 months after we've extracted the tooth. We want that implant to heal for 2 months. and then your dentist can put a tooth on top of it.
It may sound like an investment in your time, but it is so worth it. You don't want to skip any of these super necessary steps in the process. You don't want to put the tooth in before your bone, there's adequate bone in that area, or else you may, lose the tooth and lose the money that you put in. So yeah, it's important.
There are certain circumstances. There are special certain circumstances where we can extract the tooth and put the implant right in at the same time. And that saves you about 4 months.
Wow.
Sometimes even in those certain circumstances, we can put a tooth on it within a couple days. We just need to work with your dentist and make sure that all the scenarios are perfect, that everything is right for us to be able to do that. But sometimes with a front tooth, because those front teeth are so important to patients, I don't want anyone ever to have their smile have a hole in it. I don't ever, I hate a missing front tooth. And some patients, we have the opportunity to extract the tooth, put the implant right in, and even work with the dentist to get a tooth on it within a couple days. They love it because they have something that's not removable. You have to be very careful with it because it still needs to undergo that process of osseointegration, but it gives you your smile back almost immediately. So.
That's awesome. So again, that's important to come to your consultation, that very first step, so that they can go over your treatment plan, go over the steps. They could maybe see if an expedited process is something that's for you. But either way, it's really important here at the Oral Surgery Group to give you all the information up front so that you're not left in the dark, that you feel really safe and comfortable with the process, and you're left in super brilliant hands, if I say so myself. So thank you so much, Dr. Daly.
Oh, it's my pleasure. Yeah.
I'm gonna come to your office again. We didn't even talk about the office. And as always, you can give us a call or contact us at theoralsurgerygroup.com. And yeah, we'll see you in the next video.
Sounds great. Thank you very
Bye.
much. Bye.